Um, I'm Dr. Ariam Diaz, and I am here with Dr. Loretta Duggan, and we are live and so excited that you are joining us for this conversation that we're going to have about something so important for both of us since we are taking care of patients all the time with this condition. And like I said, my fellow doctor is Dr. Loretta Duggan, and I'm just going to let her introduce herself just because she will do the best job at introducing herself that I can do it on my own.
Oh no, I'm sure you would do just fine. So no worries on that. But hello everyone. My name is Dr. Loretta Duggan. I'm trained in family and adolescent medicine, and I'm also the CEO and founder of Her Health, located in Athens, Georgia. And at Her Health, we focus on helping our teenagers and young women to confidently embrace their menstrual, their reproductive, their sexual health in order to live the life that they choose. So, we really want them to understand the importance of compassionate gynecology care and how they can start advocating for themselves and their needs sooner rather than later.
Perfect. Yes. And this is why it's so important for you to to focus on like menstrual and adolescent health and menstrual health, because it's very important for all girls to understand their menstrual cycle, understand what's going on, understand when something's wrong, like what discharge is good or wrong. So talked about to us a little bit about why it's so important for girls to understand the importance of their menstrual cycle.
Absolutely. And that's such a great question because it's something that we're naturally going to do. Is unless medically, it's not going to typically just go away.
Yeah.
And if it does, then it means there's something wrong. And coming from a personal standpoint, I personally dealt with really painful, really heavy periods as well. And honestly, I didn't really know what to do or where to go. And quite frankly, I felt like my mom wasn't sure what to do with me either.
Mhm.
So I wish I knew someone like myself, what I'm doing right now, so
Mhm.
that I could have someone to go to. Because when we're talking about period pains or just our period health in general, sometimes it can be quite disruptive. Like it's literally disruptive to our day, to activities we may have going on. I was missing school, having to leave early, even with practices. Sometimes I just couldn't go because of the amount of pain that I had going on. And it
Mhm.
wasn't just pain by itself, right? It was pain plus a little bit of diarrhea, some
Yep.
nausea, vomiting, feeling like we're going to pass out. And so truly trying to figure out those symptoms and how to best care for myself when I didn't see a lot of people dealing with that was tough. It was hard.
Yes.
And I had to kind of figure my way through it
Mhm.
until training to be a whole family medicine doctor, and I realized that I had a diagnosis and there was medicines to help for me, and I knew how to actually start to advocate for myself at like almost 30.
Oh.
And I knew that no one else, they couldn't know because we weren't talking about it. So if it's not being talked about, but you're still experiencing it, you deserve help. You deserve that treatment. And that's what I want to bring to our young women with
Yes.
my practice with Her Health.
Yes. And I think that's so important. Like people tend to not talk about it. Like people think like
Mhm.
period, it's some like, menstrual cycle or periods are something that you have to keep it to yourself. And it's just
Right.
like something to be like, under the cover. We're not gonna talk about this. This is what's gonna happen. You're just gonna have your period and everything's gonna be fine, right?
It's still
So
so much shame and so much stigma around
exactly.
something that is baseline and so natural for us as women to go through. And we're not going through it for just like a few years. No, this is decades of our life.
Decades,
Like over
exactly.
half our life is going to be spent dealing with our periods
Dealing with
in one way, shape, form, or another. And so it's so
exactly.
important that we get comfortable, that we understand, like you mentioned earlier, what's normal and what's not, when to seek care and where to go
Yes,
to get the care that's needed.
exactly. And where because not everybody's gonna guide you, or not everybody was
Right.
gonna tell you exactly what's okay and what's not okay to experience when you have your period. So I'm so glad we're having this discussion, and thank you for
Yes.
sharing your story. This is so powerful.
Yes.
So, so the topic today is pretty much what we want adolescent or young women to know about dysmenorrhea. So, how do you define dysmenorrhea in adolescents, and how common it is in your practice to have young adults coming complaining about it?
Right. And I'll add on to not just our patients, but their parents as well,
That's right. Yes,
because
I
it
agree.
starts with them understanding that this may not actually be okay. They're not just trying to skip school or some other things
Hmm.
or that test that may be going on. They truly are suffering, and we want to acknowledge it and put a name to it and then come up with a plan to address it. And with dysmenorrhea, the way that I defined it is just painful periods, whether it's during your cycle, a little bit before, you may have pain, and it's on a spectrum as well. So some individuals may have mild symptoms where they can get by with a heating pad because we know the uterus is a muscle. So she's being told what to do by hormones called prostaglandins, and she's following orders. She's cramping, she's following orders every single month, typically on a certain frequency for most people. And so, whether it's a heating pad that can get you through to help relax that muscle so that you can get through your day, other people may can get by with over the counter medications like a Midol, like a Pamprin. And then you have others that have more pain on a higher spectrum. We're talking similar to my own story, where now we're starting to miss school, or the over the counter things aren't helping, or maybe they helped before and they aren't helping the way they used to. Those are all signs and times where, okay, it may be time to reach out to your doctor, to the gynecologist or adolescent medicine specialist, so that they can help your teen and your woman sooner rather than later.
That's right. And for most part, you know, like everybody comes to the clinic and say like, well, I just have a little bit of cramps. And that's, is that normal? Is that okay to have a little bit of cramps, Dr. Dagan? What do you think?
Yes, and it's important to get granular too, because a lot of times they may rub it off or just kind of shake it off.
Hmm.
Yeah, I have cramps, but I just kind of deal with them.
Hmm.
And so for some, that can be their normal, where they are able to still function. But here's what I want to know. If you are no longer able to function during your day has to stop because now your period has started.
Hmm.
That's where we're thinking, okay, this may be a little bit deeper than surface level, milder symptoms of dysmenorrhea. And you asked earlier in terms of how many of my ladies deal with it. It's actually my number one diagnosis.
Hmm.
Dysmenorrhea is the number one reason why young ladies, why our teenagers are coming to see me, because it's disruptive, because parents are having to take off work to pick them up early or to keep them out of school.
Yes.
This is the number one reason why they're seeking care at my clinic, so that they can help to really improve their quality of life.
Yes. And this is the key point, you know, that I think is the most important thing. If you having a period and or pain when you have your period and you are not able to do what you usually do, then that's not a normal pain. So it's something
Correct.
else. You have to look for something else, and you have to look seek for help, because you're not supposed to be on bed 24 hours when you have your period. You're not supposed to do that. And if you're missing school, if you're missing your daily activities, if you know, like, if you're missing your life just because you're having pain with your periods, then that's a red flag. And that's something that you have to tell your provider, you have to tell your doctors, so we can help you and help understand what's going on as well. Okay. And then, so if you have a teenager or a young adult that is missing a lot of school or daily activities because of their period, how does this influence your treatment plan? Like, what do you think? How do you start treatment for those patients?
Sure. So first, like you mentioned, we want to know how are you presenting during your periods, and we're going to take a full period history as well, because that's going to help to guide us in terms of what steps we may take next or which treatments may be most appropriate for us. So when I'm thinking about our period history, I want to know menarche. So the very first time, very first period that you had, I want to know how frequently are they coming? Is it like about every 28, 30 days, the way we would kind of normally think of? Or are you having periods every 2 weeks? Or is it 6 weeks, 3 months down the line that you're having periods? Because that'll kind of help us too to figure out, do we need to think about labs, something that's causing your irregularity
Yes.
versus your periods haven't quite sorted themselves out yet.
Mhm.
The other thing I want to know is your flow. You know, how heavy are you bleeding? How often are you having to change? Some of our heavy flowers may have more cramping associated with that as well. Now they passing clots. If they're the
Class.
size of a quarter or larger, we
Mhm.
want to know about it because you may be bleeding a little bit more than you recognize.
Mhm.
And then two, duration, how many days are your cycles lasting? Is it about the average 7 days or a little bit less? Or now we're up to 8, 10, we're bleeding 2 weeks at a time. So it all kind of ties into, in addition to asking about our period pain, what are we having to use? What have we tried? How did it work for you? Did your mama have pain? How about your sisters, your aunties?
Mhm.
Tell us about your family history as well, because now if we know, okay, there's PCOS in the family, there's endometriosis that's in the family, do we need to keep those diagnoses in the back of our mind while we may be starting first line treatments?
Yes.
So, some of the first line options that we can consider, one would be the class of NSAIDs, so non steroidal anti inflammatory drugs. We're thinking ibuprofen or possibly naproxen, which is what's in a lead, but they also have prescription strength too. So, it is a little bit of a difference when it comes to the strength of our NSAIDs. So long as there are no contraindications that we're aware of, a lot of times we can start there first, or families may feel more comfortable starting with something that's non-hormonal. In
Mhm.
addition to some of the things that it may have tried, like heating pads, for example.
Mhm. Mhm.
Another potential kind of first line I think of too, if our NSAIDs aren't working, aren't completely resolving our pain and discomfort with dysmenorrhea, with these cramps, we may can think about hormonal therapy. So if I do have a patient that's presenting to me and they have the nausea, the vomiting, they're having GI symptoms like possibly diarrhea as well, they're meeting more severe criteria,
Mhm.
that may be a conversation that we need to have, that maybe yes we can start NSAIDs, but it may be a point that we need to consider hormonal therapy.
Yeah.
And I like to call it hormonal therapy because yes, it is birth control. They're like birth control pills. I'm like, okay, yes,
Yes.
but we're using it for a different reason. We're using it
Yes.
for another reason in this case. And it's just like a side effect. By the way, yes, it can prevent pregnancy too, if
Yeah.
need be. But the priority is to improve their quality of life so that they can
Correct.
control their pain, not their pain controlling them when it comes to their periods.
Correct. Thank you so much. And with these two things that are, that you touched that are very important, I think it's very important for all teenagers and parents, moms, to understand their pattern of getting their periods. And sometimes we don't have like a clear menstrual history because sometimes, oh, I don't know when was the last time that I had my
Mhm.
period, or I don't follow a calendar. So one of the things that I usually ask my teenagers is always get an app, just get a quick app or just your calendar in your phone and put when was the last time you had your period, because this is very important for us to know and to track it, because we need to understand how often you're getting your periods. Like,
Mhm.
is it too long? Is it too short? Like, we need to understand those things. And the family
Yes.
history, family history is so important. And sometimes moms don't want to share a lot of their history. So please be open, because we need to understand how to best help your child, And in this case, family history, like what happened with your grandparents, with your aunties, because that's really, really significant when it comes to menstrual history. Um,
Mhm.
and yes, most parents don't want to start hormonal therapy right away.
Mhm.
They feel like we're just like pushing their kids to being sexually active or get into trouble. But the reality is that sometimes NSAIDs or like ibuprofen is not gonna help. Naproxen sometimes not gonna help, or it can cause some other side effects that we don't want them to have. So
Mhm.
our best option sometimes is just starting like we call it OCPs, but it's just hormonal therapy in that sense. So thank you for sharing those things. So what will be your red flag? Like when would you think this is not just your primary dysmenorrhea, right? Case. This is something else. So when do you start putting the pieces together on your puzzle and say like, well, we need to do something else?
Right. And before I get to that, the other thing that I'll chime in with tracking our periods, we definitely want to know the first day of that last period. So
Exactly.
our last menstrual period is a little bit, it can get a little confusing, but the first day is when the clock resets for your cycle.
Mm-hmm.
So that's why it's so important that we make sure you pick whatever app you like. Pick a free one. There are plenty of free ones
Perfect.
that's available. The calendar on your phone or a good old paper and pencil. If you can keep up with it, use whatever works for you. But
Exactly.
definitely tracking that first day, and then we can kind of put the pieces, the puzzle pieces together from
Mm-hmm.
there. And like you mentioned with family, by the time we start talking, Mama done came up and remember all kind of stuff that was going on. It's like, oh yeah, my sister did do this. Oh yeah, your grandma did have heavy periods and have a real bad attitude around the time
Everyone.
yeah, everything just starts coming out then. So please, please, please share that family history because honestly, we truly do want to know all about it.
Mm-hmm.
In terms of red flags, things to look out for, we kind of talked about the quality of life piece.
Mm-hmm.
If we're having really severe symptoms that are disruptive to our days, but also if we're having period pains, let's say it's not just day one or day two, now it's throughout almost the entirety of our period
Mm-hmm.
duration. All those days, the cramps aren't getting lighter, aren't getting better. They're still pretty painful throughout the entire time. And then also, if we're having more of a chronic, almost chronic period pains that are present, pelvic pains that are going on, and we're not even on our period,
Mm-hmm.
that can be a red flag also. How
Okay.
about for those that we've already started, say on NSAIDs, or we've tried with hormonal therapy as well, and we're still having unresolved pain? That's another big flag for me too, that we definitely need to look a little bit further, not just at primary causes, what we call primary dysmenorrhea, but now do we need to think about secondary dysmenorrhea as well, where we're thinking about something structural that may be going on, like fibroids? Do we need to think about endometriosis? Or
Mm-hmm.
if we're having this continued irregularity and it's been at least 2 years or so since our periods first started, is PCOS something that we need to think about as well, or thyroid issues, or diet, how we're eating?
Mm-hmm.
So a few things can kind of point us in those directions. Let's say if it's been a huge change in weight, either up or down, yes, that can affect our periods too, but do we need to work that up further and focus that way? Let's say if now you're having super hard to control acne that's going on, or hair that's growing when you know you don't have no mustache and you don't have a beard or anything, then these are things that may push us towards hormonal workup sooner rather than later.
Mm-hmm.
And so, really, it's going to depend on some of these presenting symptoms,
Mm-hmm.
or mention some GI things before, if we're having either constipation or diarrhea, or like urine frequency, recurrent UTIs that's going on. Those may can be signs that can possibly point to an evaluation for endometriosis that's needed. So
Mm-hmm.
really it will depend on our symptoms, how we're presenting, in terms of what workup will need to be done next. And those are certainly some things that will get my antennas up if you're mentioning any of those things that have happened with you or with your periods, or if you mention that about your child, then we're going to definitely go further a little bit quicker
Yeah.
than most.
Yes, and now we have a lot of information, out there with endometriosis, PCOS. So most most patients or some patients will come to the clinic and say like, "Hey, I just want you to tell me to do some blood work because I think I have PCOS." And really, the history will show us a lot of the things. So that's why we need to have like clear details of what's going on, not just like a, oh, this is what's going on and this is the thing that I think you need to test my daughter for, right?
Right.
We need to be very clear as to what's going on your daughter's daily activities, daily habits. It's a very clear history that would allow us then just pinpoint which test, if
Mm.
needed, then we need to do.
Yeah.
Um, yeah.
And I was going to say too, in regards to that as well, yes, really the first visit, most teenagers for sure, and even some of my young adults too, my young women, they can be so concerned about the pelvic exam. We're going to
Mm-hmm.
do a
Yeah.
full exam where you have to do a speculum exam and all the things. And honestly, sometimes with that first meeting, it's us talking. It's just us talking. I want to know the history. I want to know the background story. I want to know the family history.
Yes.
Because truly, that's going to really set us on the path of the best treatment plan for us before I do any type of speculum or
Mhm.
a pelvic exam. Like that may be something that comes way down the line or later
Yeah.
versus us getting that history, which is honestly the most important piece
Yep.
to this puzzle.
Yeah. And for how long do you track? Like, let's think that you start someone on NSAIDs or even hormonal therapy. For how long do you track them before you start thinking, like, if it's not working, then we'll have to do something else? Do you wait like 3 months, 6 months? How long do you usually track those patients for?
Yes, so I would say it really depends on their menarchal age. So when did they first
Mm.
start having their periods? Because if they're like 6 months, they just started their cycles, we may have a little bit of time to see how their periods are going to prove themselves out to be. And we kind of support them within that first year, possibly even two, depending on their symptoms that they're having, and then we can maybe reassess from there, whether
Okay.
it's a trial off of medicines to see how they do, kind of what's comfortable for them and within reason. But for others that have been at least maybe 2 or 3 years post menarche, okay, we may give them about a 3 month trial
Okay.
to see how they do with any particular therapy that we start for them, any treatment plan. But I'll tell you, it's been sometimes where they call me back after like a month and they're like, I know we talked about NSAIDs, I know we talked about this naproxen, but it's not cutting it. So those hormones we talked about, let's go ahead and start that and I'll let you know how it does before the next visit. So that's why I say the talk and the communication piece is so important. And even for our parents that are kind of afraid or unsure about hormonal therapy, or that may not be the first route that they want to go, hey, I understand. We're here to work together to compromise. We want your child, your teenager, your young adult to be the best that they can be.
That's right.
So we're going to walk through, I'm walking them through the process of what I'm thinking. If we're thinking NSAIDs, let's see how they do. If that doesn't work, then this is the next step that we're going to go to. If
Mm.
some labs have already been done, perfect. I want to look at those too and see what we may need to add to
Exactly.
it depending on the presenting symptoms. So I'm
Mm.
going to try to walk them kind of down the pathway that I may be thinking so that it's not a surprise for
Yeah.
them in case we reach that point where we need to pivot and do
Hmm.
something differently.
That's right. That's right. And how do you convince, well, I don't know if this is the right word, but how do you address parents when they're like on the fence? They're like, no, definitely I don't want to do hormonal therapy for my kid. She's too young, or I don't want them to cross the line or anything like that. So how do you address that concern that most parents will have?
Right. With that, and just for full reference, I'm a sociology major. So I
Oh,
wasn't a general chemistry, biology major from college. No, I'm a sociology. So I want to hear all the background. I want to hear all the whys. Tell me why you're hesitant about hormonal therapy. Did you have a bad experience? Did someone that you know that was close to you have an adverse effect with it? Did they develop blood clots or something else happen where it makes you super nervous about your teen starting it too, even though we know potentially it could be super helpful, like a full 180
Mhm,
for them. So I kind of want to know their background story or experience with it as well, because that may help to guide some myths that may be there while we're trying to reach the ultimate goal, which is improving quality of life for the
mhm,
patient, hands down.
mhm,
So once we can get behind the scenes to understand that, usually we're able to make some inroads one way or another, just making sure that they understand that I'm still listening to them and their concerns as well. We're still addressing them, trying to get to a little bit of the root of why that may be that they hold some of those thoughts and potential myths about options that are available,
mhm,
and then addressing them really to help advocate or come up with that best treatment plan
mhm.
ultimately for the patient themselves.
Yes. I do have a large Hispanic population. And for
Hmm.
most part, their main concern is like if they start hormonal therapy way too early, they're not going to be able to have babies. It's going to affect
Yes.
their fertility. Like, what
Hmm.
would you tell those parents today?
That is the biggest concern. It's like, if I
Right.
have to be in this for a long time, what happens when I'm actually ready to start a family or if I want to do something different? And I'm like, once you stop it, typically for most people, depending on the method, your fertility and your periods are
True.
typically going to go back to
Hmm.
what they were doing before, go back to that baseline before any medications were even started.
Exactly.
So again, typical case, people are still having babies. And I like to tell them too, like, let's say that you're on pills. People have missed and skipped pills and ended up pregnant.
Yeah.
So it's still very possible, that once you're off those pills, that absolutely you can still have a family. Now, I do let them know, and I say depending on the method, right? Because if
Mhm,
we're on, like, say, Depo Provera, which is an injection every 3 months,
mhm,
and you've been on it for a while. Now, with that one, there may be a prolongation before your fertility goes back to its baseline, sometimes up to a year and a half.
mhm,
So, if that's a method that's chosen, I definitely let them know ahead of time. Okay, with this one, it may take a little bit longer. Not impossible, but it may take a little bit longer. So, to be
mhm,
aware of that for future reference
mhm. Yeah,
when they're choosing to stop that medication. But yeah, for all the others, like implant once it's out, IUD once we pull it out, pills once you miss one or you stop,
that's it.
everything pretty much, yes, goes back to the way it was before you even started those hormones or any type of hormonal therapy.
That's
Yeah.
right. That's right. And then I think, the most important thing is that your period should resume normally after you're done with whatever hormonal therapy you're doing. If
Right.
not, then there's something else causing
Hmm.
major
And
problem.
again, I was gonna say whatever your normal is, right? Because if you were
Exactly.
skipping 3, 6 months at a time, you may
That's what's
find
going to
that your
happen.
period may start to go back to
Hmm.
doing that as well once you're
Exactly.
off of any type of hormonal therapy. So whatever it is that your baseline is that we that
That
we're
we already
starting
agree.
with, that's right. That's right. That's
Yeah.
that's what it's going to go back to
Yeah.
at the end of the day as well. That's going to
Oh.
be the default.
That's gonna be the default. Exactly. That's how your cells are primed to think, right? So that's why it's
Mhm.
the default. So you're just gonna go back to the same thing you used to do.
Yeah.
And Dr. Duggan, so if there's one thing you will like young adults, teenagers, moms, parents to get away, like one big message to get away from this talk today, what should it be?
I think the one message that I would want everyone to know is we want you to live the life that you choose, not the one that periods may choose for you.
Hmm. That's
We
right.
want you to be able to have the power and be empowered to
Hmm.
know what to look out for in terms of what's normal for our cycles, what's not normal for our cycles, potentially red flags that could be present. And I always say if the first doctor, the first office that you start at, and you see that they're not going as deep as I need them to, or I know they say things are okay, but it doesn't feel okay,
Hmm.
please get a second, third opinion if need be. Do not stop advocating for yourself because we only see you for a small snippet in time,
Hmm.
but you know and are most familiar with your body.
Yep.
And you want a medical team that's going to be a strong advocate for you and what you need. So don't stop looking and
Hmm.
don't let your periods, run your life. We want you to live the life that you choose.
Yeah, yes. If you find someone that is just gaslighting you, like, oh, you'll fine, don't worry, it's normal, this is typical for your age, someone that is dismissing your symptoms, you need to learn how to advocate for it. Like, no, this is not normal. So thank you so much, Dr. Degan, for
Yes,
joining
you're
us
welcome.
today. And I appreciate for you taking your time. I know you're visiting your clinic with your patients, but can you tell us where people can find you?
Absolutely. Thank you so much for having me today. I love talking about all things periods, reproductive sexual health. So this is my jam. So absolutely love being here with you all today. So yes, the name of the clinic is Her Health and we're located in Athens, Georgia. On most social medias, it's Loretta Duggan, MD. So my first name, last name, MD. That's my handle, whether it's IG, TikTok,
Everywhere.
you'll find me there. Yep, I'm on Facebook as well. Dr. Loretta Duggan, Her Health is a little bit longer. But yes, please check us out, follow us, and just can't wait to continue to connect with the community.
Well, thank you so much. Thank you for your time. And once again, this is Dr. Ariam Diaz from Bright Side Care, and we'll see you next time. Thank you so much. Bye.
Thank you. Bye.